Hello, first year faculty. Welcome to our 11th week in the semester. That means we only have 5 more weeks of clinic left, which is hard to believe. Here is your information for this week. For students who were not successful on their first SARP evaluation, Jill's going to start pulling randomly a second chart to be audited. I'm going to complete those second evaluations just for consistency, and then if those students do receive a second U, I can get their remediation taken care of. So once you've completed your first one, you are all set on those. Speaking of SARP, I do want to note that in the section of SARP that says plan for successive visits, the students in that section can simply write that their plan is to continue their prophy or complete their prophy if the patient's coming back to have that done. They don't need to specifically say, SCL and PRO and all of those things. Just that simple statement is fine. If the patient is done, then they should write recare prophy in that section. They really don't need to put the interval there because the interval is going to come at the bottom of that section. If they put it in, fine, but if it's missing, that is totally fine. Quick reminder that rescale errors are a -2 instead of a 1, so please just double check your calculations when you're doing the final grades. I did address a note from the notebook this week about reviewing the dental hygiene summary diagnosis section with the student. So we revisited problems and etiology that they might come across. And the examples that we went through in class were BOP, pocket depths, 4 and higher. We talked about recession. We used biofilm buildup as an example. Caries risk was another example. And then for etiology, we reviewed things like inadequate gingival stimulation, maybe a brushing technique that needs some modification. We talked about host response. We talked about aggressive brushing. Nutrition and how that might relate to caries or caries risk. So I did review it this week. If you could pick up with that in clinic as well and review those items with students, kind of help them plug that information in, that would be really helpful. We held our patient education seminar on Thursday of last week. It went really well. We reviewed all of the self-care aids that we've got, and then the students received a sample of all of our self-care aids, and they were asked to go home and play with those and practice using them in their own mouths to better know how to recommend them for patients. So they have all of those supplies. We reviewed all of our toothbrush options, all of our mouth rinse options, and when we would recommend those. We also created a menu of self-care options that we've got here. We included we included toothpaste, mouth rinse, interproximal aids, things that we would recommend for crown and bridge, things that we would recommend for ortho. And the students can either have those digitally on their iPads, or they may print those and put them in their clinic binder. But I'm hoping that helps them to be able to customize things a bit more on their care plans for their individual patients. And then I do want to remind you that if it is appointment 1 for a patient, to please give the student the toothbrush at huddle. That way they can be doing, they can find out how their patient's brushing, and they can get that information into the care plan. And then if they're waiting for us, they can review brushing, because they've got the brush in their hand, so they can use it inside the patient's mouth. I also let them know if they're waiting for a faculty member for check-in, they can request the other self-care items while they wait, and that way they can review those while they're waiting for their check-in, which would be a really good use of their time. They were told, though, not to disclose, of course, prior to the RDH check-in. So if they do ask you for those items, go ahead and give them to them if you can't get in there right away. We also, during the seminar, looked into some products that are popular on the market right now. So the students did some little mini research sessions into, we did the Burst toothbrush, the Quip toothbrush, we did Spry xylitol products, we did the Brush DJ app, and charcoal toothpaste. And so the students reviewed those, and then they came up and did a little presentation for their classmates. And we looked at things like, who is this marketed to? Do we think it works? What do the user reviews say? And is this a product that you would recommend? So we had a lot of fun looking into some of those products that they might be seeing on social media. Let me just double check. I think I've shared everything I need to share with you. Back to SARP for a second. Sorry about that. Once you've completed your first SARP evaluation, please note it on the bulletin board in the faculty office. And there is one more key item that I wanted to discuss with you, and that is signatures when you're reviewing your the student's quality assurance form. If they are missing a signature before they start treatment on something that has a star, and so that would be informed consent, for example, or patient responsibilities. Actually, I don't think patient responsibilities has a star, but certainly informed consent would fall into that. A medical history is what I'm trying to think of. So if there's a signature missing on an item that has a star, and the patient and the student has started treatment, you can give a single star critical that, and I wrote it down on the newsletter. It is called Followed Guidelines for Records Documentation and Management. You don't need to give them a double star. So I'll leave that there. That is also applicable for the care plan. So if after check-in, they forget to get their care plan signed, but they start scaling and you notice that that's still that single star. If the chart gets to me and I audit all the paperwork in the chart. So if it comes to me and it's missing a signature in one of those starred areas, that is when that would go into a fail for the student. So I will take care of that documentation. I will note that the signature was missing, and I will take the patient credit. So just to kind of clear that up, because I know that there were some questions about that. Otherwise, I don't want to make this video too long. There's a couple other brief items that you can read through on the newsletter. I hope you have a wonderful week. If there's anything that you need or any questions that you have, please do not hesitate to reach out.